Good morning, all. Today, our topic for discussion would be drunkenness certificate and the forensic medicine aspect and the legal aspects of the drunkenness certificate and how to examine a person. So let's see some basics about alcohol. So alcohol is basically derived from an Arabic word. The meaning in meaning in Arabic is alcohol, which means something subtle. So it causes a minimal drowsiness, and initially it stimulates the CNS, and then later on more doses it acts as an depressant, a CNS depressant. And then the alcohols are hydroxy derivatives of aliphatic hydrocarbons. So they are basically both lipid and water soluble. As the dose and the quantity increases, it is less water soluble. It becomes. They are transparent, volatile, flammable, colorless liquid having a characteristic alcoholic fruity odor and a burning taste. And so we on postmortem examination or on a living person we get a rotten fruity odor. So this is the third most common drug of abuse after caffeine and nicotine. So the first being the most common substance of abuse is being the caffeine, and next the nicotine, and the third will be the alcohol. And then something about its absorption. The alcohols are, this is mainly based on the ethyl alcohol, which is absorbed 20% in the stomach, and the rest 80% of the alcohol is absorbed only from the duodenum and the first part of jejunum. The reason for this absorption is due to the thin mucosa, its better blood supply, and the larger surface area for absorption. So, the in persons with gastrectomy and other things, the alcohol absorption is more faster. And then it's emptying time. And then after absorption, it is metabolized in the liver and then excreted mainly through the kidneys in the urine. And then its time of absorption is in an empty stomach. It is absorbed. The 60% of the alcohol is absorbed in 30 to 60 minutes, and the whole of at almost 90% of the alcohol is absorbed in 60 to 90 minutes. Okay, that will be the maximum concentration of absorption. So it is detected in blood in 2 to 3 minutes. And so that is the detection in blood can be used for the breath smell of alcohol, and then also in the alcohol can be thought in the breath analyzer also. And then this is about the metabolism of alcohol. So the alcohol in the liver is acted upon by the enzyme alcohol dehydrogenase, which is converted into acetaldehyde. Then the acetaldehyde is converted into acetic acid or acetyl CoA by the action of the enzyme aldehyde dehydrogenase. And then the acetic acid enters the TCA cycle and is converted as water and carbon dioxide. And then the deficiency of aldehyde dehydrogenase enzyme causes a condition called as alcohol flush syndrome, which causes accumulation of acetaldehyde more in the body, which causes flushing of faces and then the redness and the swelling of faces, which can be treated by disulfiram. And then the signs and symptoms. Based on the blood alcohol concentration, the stages of consumption of alcohol has been divided into 6 stages. A minimum quantity of 0 to 50 mg is called as the stage of sobriety, where where the person has no significant effect, and then he acts as like a sober, where the person is a bit sleepy or very normal without any symptoms. And then a blood alcohol concentration of 50 to 100 milligram percentage causes stage of euphoria. Euphoria is the feeling of well-being. And then the main important symptom here would be the decrease of inhibition. The person where in places where the inhibition has to be present is lost. So he talks more and started to be a bit talkative, increased self-confidence. This leads to rash driving and negligent driving and causes accidents. And then the next stage would be the stage of excitement at a blood alcohol concentration of 100 to 150 milligram percentage. Here there will be a lack of self-control. A person start to lose control of its thinking, and becomes more talkative. Here, the fine movements are affected, and the person is not able to do fine activities like writing or holding things properly. And then the impairment of memory is also present in this stage of blood alcohol concentration. And then the stage of disorderly behavior, which is seen at a blood alcohol concentration of 150 to 200 milligram percentage. Here, the symptoms will be incoordination of the muscles, where the person is not able to stand properly or walk properly. Then the skilled movements and the perception are affected. Increased reaction time. The reaction time, once you call a person, the time he takes to react back is increased. He takes more longer time to react. And there may be a slurred speech, and then staggering gait and confusion. Staggering gait is the person will not be able to walk in a proper straight line. And then there will be disorientation and visual disturbances. And then the next stage at a blood alcohol concentration of 200 to 300 milligram percentage is called as a stage of stupor, where there is diminished response to any kind of stimuli. Even the pain stimuli, a deeper pain stimuli, there will be a minimal response from the person. And there will be inability to stand or walk, and vomiting will also be present. And finally, a stage of coma, which is seen at an blood alcohol percentage of about 300 to 500 mg percentage, where the person becomes unconscious, and the reflexes are totally lost. The temperature decreases, and there may be incontinence of urine and feces. There may be respiratory distress, and the person may go into coma, and finally, death can happen. And then the cause of death. The cause of death in alcohol consumption or in acute intoxication due to more amount of consumption of alcohol. The first main reason to cause death will be aspiration of the vomit. As the reflexes are lost, the person will not be able to resist it. The gag reflex will be absent, and the person trying to vomit will aspire the vomit material, and that enters the respiratory system and causes asphyxial symptoms and death. Then the next symptom may be depression of the brainstem. That is mainly which causes brainstem depression, and which leads to respiratory failure mainly. And there may be cardiac failure also, which leads to death. But in chronic intoxication for more than very long time, there may be cirrhosis of liver, which may be micronodular or macronodular cirrhosis, which leads to hepatic failure. Ruptured esophageal varices may cause, which causes sudden rupture and bleeding, with collection of blood in the esophagus and stomach. And then alcoholic cardiomyopathy can happen, and pancreatitis may also cause death in chronic intoxication. And then let's enter into a topic of drunkenness. So this is the basic definition of drunkenness, which is a simple one. So it is basically a condition. It's not any disease. It's a condition produced in a person who has consumed alcohol in a quantity sufficient to cause him lose control over his faculties to such an extent that he is unable to execute safely the occupation in which he was engaged at that particular time. So this is the basic definition of drunkenness, which means it's only a condition produced by himself, a person who takes alcohol in a quantity in more quantity that he's not aware, or he doesn't know what he is doing, and he is not able to execute the occupation he was doing at that particular time, and all those things are lost. So aim. The main aim of drunkenness certificate and the drunkenness examination. So this examination is mainly based to decide whether the subject is under the influence of alcohol, and if yes, what is the extent or how much is the quantity of consumption. That is the main aim of our drunkenness examination. And next thing is to decide whether his condition is due to illness or injury. So there are certain illness or conditions which mimic all the symptoms of the consumption of alcohol. So the differential diagnosis of alcohol consumption has to be ruled out. So that will be the next aim of drunkenness examination. And next is to decide whether it is safe for him to be detained in a police station or to decide whether he is to be admitted in a hospital. That is, if there are any other differential diagnosis, the person has to be admitted in the hospital and treatment has to be given. So that has to be ruled out whether he is able to survive in a police station or he has to be admitted in a hospital. So these are the aims of drunkenness examination. So some differential diagnosis of consumption of alcohol. The first main thing to be differentiated should be the head injury, which mimics the symptoms of consumption of alcohol. The blood alcohol concentration of more than 200 milligrams percentage mimics the head injury. And next thing will be the cerebral tumors. All these causes a mild drowsiness and the unconsciousness and causes symptoms similar to that of alcohol. The other differential diagnoses are hypoglycemia, hyperglycemia, thyrotoxicosis, delirium, uremia, carbon monoxide poison, barbiturate poisons, narcotics, antidepressants, and antihistamines. So all these drugs and poisons also mimic the consumption, the symptoms similar to that of consumption of alcohol. So that has to be ruled out. And then entering into the proper certificate. The as a whole, as a medical legal certificate, a certificate consists of three parts, which are mainly the preliminaries, and then the detailed examination will be the second part, and then the final part will be the opinion part. So initially we'll see about upon the preliminaries. The first thing is to be a request from the police officer to proceed an examination. A doctor should attend the case as soon as possible without any delay to check whether what is the level of alcohol and whether and to know the to know whether the person has consumed or not. And then the other differential diagnosis has to be ruled out. So the examination has to be started as early as possible. The first thing that has to be done is to get an informed consent before examination. So in a conscious person who is of sound mind, the consent has to be asked to himself whether he is ready for the examination or not. So if he is okay for the examination is proceeded and the opinion is given. So, but he refuses to give consent, go against him or the person or the burden depends upon the police officer who has brought him for examination. And then if the person is unconsciousness or under intoxication, he is in a position not to give any consent. If it is not available, the person is examined first and the treatment is given. And then after regaining the consciousness and before submitting the report to the court, take the consent of the person. Okay, that is to be done in unconscious person. In an accused person, the consent is basically not required from the accused person. A case has been filed against them and is brought by the police for examination. So according to sections 53 subclass 1 of CRPC, and now it has been changed to BNSS class 51 subclass 1, no consent is required for the examination. So the examination without the consent, the examination can be proceeded. And then after the consent, a physical examination, a detailed history has to be taken from the alleged person, and then which includes the name, sex, age, occupation, his residence, the place of examination where the examination is taking place, the date, time, and a minimum of 2 identification marks has to be obtained. The first identification mark or the identification mark can include any moles or scars. A minimum of 2 is required. And then the history, a detailed history of any other disease or chronic disease or injuries that has to be excluded. Is he suffering from any disability has to be ruled out. That the any other previous illness or he is on any other treatment has to be asked for. Any other substance of addiction other than the alcohol has to be asked and ruled out. And then about the history of consumption of alcohol or not. The history from the alleged person has to be taken whether he has consumed alcohol or not. If he has consumed, it has to be ruled out whether it was consumed by himself, or he was forced to consume by others, the persons who are along with them. So this issue is important as to regarding the punishment side. So the person, when he commits any crime after consumption of alcohol, and if it is found out to be forced by some other to take alcohol, the burden of responsibility gets split up, and the other person is also chargeable. Okay. Then the next history that has to be asked is the quantity and time of consumption of alcohol to assess how much is the quantity and time of consumption. So any other food with alcohol, there are certain foods which increases its absorption and decreases its absorption of alcohol from the intestine. And then the general examination. After the physical examination and the history, the general examination has to be done, which includes the recording of the vital signs, which are the pulse rate monitoring, the blood pressure monitoring, the temperature, and the condition of the skin, whether it is dry or moist, or pale or flushed. So, how is the appearance of the skin has to be noted. And then the general behavior includes the manners, how well he behaves. The manners includes to be noted is whether he is aggressive or emotional or abusive, or he is in exaggerated mode. The manners has to be noted. And then the comment on his clothing has to be done. The comment on clothing is whether the clothing are clean or dirty or properly or improperly worn or soiled with dirt or vomitus. That has to be noted. And then the next thing will be the speech. The speech is the way he talks, how, whether it is normal, he or talkative or slurred speech or over precise, incoherent, articulated or abusive. All these things has to be noted by asking some simple questions to him and the way how he responds to our questions. And then in the general behavior, other than all those things, we also have to look for the self control of the person, whether he's able to control himself, or he listens to others to get control, that is present or absent. And then the breath smell of alcohol, that has to be noted, which is the very important finding to tell whether the person has consumed alcohol or not. So here one main differential diagnosis regarding the breath smell of alcohol could be a auto-brewery syndrome. So that has to be ruled out, where the person in has not consumed alcohol but still gets secretions of alcohol in its own body by itself due to some candidial actions. So that is a genetic problem, and it is a very rare condition, which is called as auto-brewery syndrome. And then in the general behavior, the higher functions, the power of interpretation, whether he is cooperative or not cooperative, orientation of place, person, time, that has to be noted, whether he is able to tell where he is or who he is and what is the time of the day. And then the memory, the recent memory and the remote memory has to be noted by asking a few questions. That has to be checked and tested. And next thing will be his intelligence. Ask him some general common question, what is the day today, or something like that, and test whether his intelligence is normal or abnormal. To some important dates, his birthday or his relative's birthday, something like that can be asked to check his intelligence. And then next thing on his general behavior will be the gait. The gait, whether the way he walks, he or she, the person who walks, how is his gait? The gait is steady, or he is able to walk in a straight line, whether it is controlled. And then staggering or over precise, that is in an irregular way. Over precise, unsteady or irregular. And the manner of turning, that is based on the testing of the reaction time. Once you call a person, you stand behind a person and call him by his name, and then the time he takes to turn around and respond to our command or respond to our calling is delayed in the case of consumption of alcohol. And then stance. stances with something related to Romberg sign and which is related to cerebellar functions and the equilibrium, which is done by the Romberg sign, where uh, he or she is asked to stand straight near a wall or not leaning to the wall without any support. The person is asked to stand with the eyes closed and the feet approximated together with the support with the person standing on his sides to catch him if he falls. Okay, so that has to be checked. This test is done, and a normal person will be able to stand by closing his eyes and his feet together. But a person who has consumed alcohol or a person with cerebellar disturbances will not able to perform this test, and there will be swaying where the person is not able to stand and he moves laterally and he tends to fall. So this Romberg sign will be negative in a person who has consumed alcohol. And then in the general appearances, and we have to look for the eyes. So how is eyes appear? Whether the eyelids are swollen or not, the evidence of drooping is present, or drooping of eyelids is present or not, and then the conjunctiva. The congestion of conjunctiva is an important finding which is present even in consumption of minimal quantity of alcohol. So any other discharge present or not has to be noted, and check for its visual acuity, whether it is normal, sluggish, or absent, and the pupil, and to check whether the pupil is dilated or constricted. And then the reaction to light reaction is brisk or slow has to be noted, and then the accommodation reflex is also noted, whether it is normal, sluggish, or absent. The convergence test is similar to that of an accommodation reflex, whether he is able to converge both his eyeballs is present or not. And then a nystagmus, which is the rapid involuntary movement of the eye, is noted. Here, in case of alcohol consumption, there is a nystagmus present, which is a horizontal gaze nystagmus of the eye will be present. And one more important sign will be in a higher quantity of alcohol consumption. There is something called as a McEwen sign, which can be found in the eyes. So, in alcoholic coma, the pupil will be totally constricted. Okay, on strong pain stimulus by pinching or slapping, the pupils get dilate immediately and then they slowly constrict. So this is called as a McEwen sign, which is seen mainly in the alcoholics. The constricted pupils on painful stimulus get dilated and then slowly constrict from its dilated state, which is called as a McEwen sign. And then we have to test for the muscular incoordination. The muscular coordination tests include the handwriting. First, the person is asked to write something. He's given a piece of paper, and then he's asked to write his name or any other thing which is able to do, and then observe how he writes, whether his writing is legible or he's able to write in a straight line or not. And next thing for coordination will be finger nose test. A person is asked to stand, the examiner and the examinee has to be stand. His finger and the finger of the examiner and the nose of the patient has to be touched alternately, which is called as a finger nose test. And that should be able to see whether he is able to take his finger in a straight line. Similarly, there is something called as finger to finger test, where the finger of the examiner and the finger of the patient has to be touched. And then the next thing for coordination will be picking up the object from the floor. Example, a coin or a pen has to be put on the floor and the person is asked to pick it up from the floor. And to check whether he is able to reach the object at once or he's having some trouble to find the object from the floor. And then next thing will be buttoning and rebuttoning of the shirt. That these are some muscular incoordination tests. And then about the deep reflexes. The deep reflexes like knee jerk, ankle jerk, and the plantar jerk has to be noted and found whether it is delayed or sluggish or normal. And the plantar reflex may be extension or flexion. And then after all these examination, things for preservation has to be done. Just wearing apparels, whether if it is soaked with any vomiters or any if it smells bad, that has to be preserved. The vomiters has to be collected and preserved. The stomach wash contents in an unconscious person, if the stomach wash is given as a treatment, the contents of the stomach wash has to be preserved. And then the urine and blood are routinely preserved for the alcohol concentration respectively. And then the breath smell of alcohol, but this is rarely done. The forced expiration of air in the air balloon. The breath is rarely collected. So the commonly collected preservatives are the blood and urine. And then for the preservation, blood is mainly collected from the antecubital vein. The skin is cleaned with mercury chloride or simply with soap and water. Here the main thing to be noted is the avoidance of the using of spirit. The spirit used to clean the skin before collecting any blood sample has to be avoided, as it itself acts as an alcohol content of alcohol. So the usage of spirit has to be avoided. And then 5 ml of venous blood has to be collected and preserved in 50 for 5 ml of blood, 50 mg of sodium fluoride and 15 mg of potassium oxalate has to be collected in the container and a tightly clamped. So here we are advised to avoid the rubber stoppers. And then analysis. And the preservative for urine will be thymol. Analysis. So the analysis of blood is done with the help of Bidmark's formula and gas chromatography, and the saliva is analyzed by the use of gas chromatography and chemical reagent, and the breath is analyzed. The presence of alcohol in the breath is analyzed by alcoholometer, intoxicometer and drunkometer, and then urine it is analyzed by gas chromatography and chemical reagent. So this is about the Widmark's formula, which is the formula stating A equal to PRC, which is the total amount of alcohol, where A stands for the total amount of alcohol in grams absorbed in the body. P denotes the weight of the person in kgs, and R remaining a constant, which is 0.68 for men and 0.55 for women. And C denotes the concentration of alcohol in the blood, which is given by mg per kg. So this is the Widmark's formula used to find the amount of alcohol in blood for blood. And to find the amount of alcohol in urine, a formula similarly, A equal to 3 by 4th of PRQ. The contents are similarly where Q alone stands for alcohol concentration in urine. So based upon all these things, based upon the history, our physical examination, a breath smell of alcohol, and the laboratory report, the opinion on drunkenness certificate has to be given as 3 different opinions, where the breath smell of alcohol in the criteria A, there is breath smell of alcohol present. The physical examination also gives us positive, and the blood alcohol concentration shows presence of alcohol, and the opinion can be given as the person has consumed alcohol and under its influence. In the criteria B, there is only breath smell of alcohol, but the physical examination, all the physical examination are normal, and then the blood alcohol concentration shows presence of alcohol. So in such cases, the opinion can be given as the person has consumed alcohol but not under its influence. In other scenario, which is criteria C, there is no breath smell of alcohol. There is on general physical examination also is normal, and the concentration, the laboratory value also is negative. In such cases, the opinion can be given as the person has not consumed alcohol and not under its influence. So these are some difference between the person has consumed alcohol and is under its influence or not under its influence. To tell a person he is under the influence, he is consumed and under the influence of alcohol, the main things will be the breath smell of alcohol will be present, the eyes will be congested, the pupils will be dilated, The pupillary reflex are sluggish in response, and the deep tenon reflexes are sluggish in response. And then speech is thick and slurred. The gait is very unsteady. The defective muscular coordination is present. So, to tell a person has consumed alcohol and not under its influence, that smell of alcohol is present. The eyes are also congested. So, the condition of eyes will be present in all the cases. The pupil appears normal. No, the reflexes are normal, and his speech is normal, and then his gait is also normal or maybe unsteady, which is very rare. He has normal muscular coordination tests also. And then, based upon all these things, the opinion has to be given as of a scenario which is the person has consumed alcohol and under its intoxicating influence, or the person has consumed alcohol but it's not under the influence of its intoxicating influence, or the person has not consumed alcohol and not under its intoxicating influence. So, these three are the opinion that can be given for a certificate of drunkenness. So let's look upon the some of the medical legal aspects also. So first thing will be the prohibition area. So the entry of consuming alcohol or a person who has consumed alcohol are restricted in some areas. Like example, in a public places like cinema theaters. In many of the theaters, the persons after consumption of alcohol are prohibited. And then the driving, and there is one legal limit for driving in India, which is 30 mg percentage of alcohol. So consumption of just 30 mg of alcohol is permissible in India. So disorderly behaviors in public and places has to be punished after consumption of alcohol. So crime, attempt or has done any crime like murder, rape, assault after consumption of alcohol is punishable. Here, it has to be noted whether he has consumed by himself or someone else has forced him to consume alcohol. That has to be ruled out. Any contracts signed under the influence of alcohol becomes invalid. In the same way, the person is not the consent given by the person by the time of consumption of alcohol becomes invalid. In similar way, the sexual behavior after the any that amounts to rape. Yes, then testamentary capacity. That is a person is not capable or becomes invalid when he signs any will when he is consumed alcohol. That becomes invalid. And then there are some other duties of a doctor also after consumption of alcohol. So this is based on the driving. 10 percentage of 10 mg percentage of a consumption of alcohol doesn't harm anyone. So the 30 mg percentage is the statutory limit in India for driving. So 60 mg percentage, here the amount of accident is doubled, and 100 mg percentage causes more accident. So 150 mg percentage has 25 times more accident. So these are some IPC sections for punishment. The first thing will be BNS 22 or the IPC 84 section, which is called as McNaughton's rule, act of a person of unsound mind. So it states that nothing is an offense which is done by a person who, at the time of doing it, by the reason of unsoundness of mind, is incapable of knowing the nature of act, or that he is doing what he is doing is either wrong or contrary to the law. And then the other sections include section 85 of IPC and section or this which has been changed to section 23 of BNS, which states the involuntary intoxication. As we saw, the consumption of alcohol is forced by other persons, or the committing of the crime is by involuntary intoxication. Okay. Or the other sections will be section 86 of IPC or the section 24 of BNS, where the person voluntarily consumes alcohol and commits the crime, which is more punishable. And then, when does a doctor become liable? A doctor does his duty. When a doctor does his duty under the influence of alcohol, he is mainly punishable. When there is any death or loss of a person, or when the the injury is very grievous by a doctor who has consumed alcohol and treated the patient, he may be prosecuted under the section 304A of IPC or section 106 of BNS for as a rash and negligent act. Here the punishment will be 2 years of imprisonment without fine. So, and then if it causes death, it may also amount to professional misconduct, and the person is liable by the state medical council for a penal erasure. His name from the medical council can be removed, and the practice can also be stopped. So these are some responsibilities of a doctor and consumption of alcohol. So these are the format for giving the drunkenness certificate, which is the request from the investigating officer, and we give a reply to them, which the first thing has to be the date, and then to the investigating officer who has given us the a request for examination, which police station, and then the subject and the reference has to be done. As we saw that the preliminary details has to be filled in, the name, age, person, the name, age, address, occupation, and the consent has to be obtained in his local language, and the signature for his consent has to be taken in the certificate. And then any two identification mark. If the person doesn't have any identification mark, the left thumb impression can be taken. And then a detailed history by the consumption of alcohol, his food habits, the history of any other chronic illnesses, and its previous treatment history has to be noted down. And then the general examination. The way how he behaves, his speech, his disposition, his gait, how he behaves, his manners has to be noted first, and then the vital examinations of pulse, BP, temperature, his skin, the breath smell of alcohol, how his eyes, the condition of the conjunctiva has to be noted, and then the gait, whether it is a steady gait or unsteady gait, his reaction time to be noted, and then the muscular coordination tests, the walking in a straight line, finger nose test, finger test, the Romberg sign, picking up of a coin from the floor, his handwriting has to be noted, and then the systemic examination, all the four vital system has to be examined for CNS, the cardiovascular system, the respiratory system, and the abdomen. A general comment on all these systems has to be done. And then the bodily examination and the preservatives, the blood or urine for preservation has to be done and sent to the forensic science laboratory. See, when it is in a medical legal case, the samples are collected and sealed properly with the seal of the hospital, and then it has to be sent to the forensic science laboratory for the estimation of blood alcohol level or the urine alcohol level, and that value acts as a proper value of alcohol. So any other comments if required has to be given, and then based on the physical examination and our breath smell of alcohol and the laboratory investigation report, we can give the opinion either as whether he has consumed alcohol and under its influence, he has consumed alcohol but not under its influence, and he has not consumed alcohol. And then the writing of this place, date, and the signature of the doctor along with its name and designation completes a whole certificate. So this is about examination and giving an opinion on the drunkenness certificate. Thank you.